I'd like to introduce the next speaker. It's Dr. Batool Kazim, who's a psychiatrist and neurologist from the Federal Medical Center in the United States. She's going to speak to us about self-care for healthcare providers in prevention of burnout, a neurobiological aspect of stress management. Thank you. Dr. Batool.
First of all, I want everybody to take a deep breath. Self-care. Okay. So I'm very honored and privileged to be invited to come and speak to you all. When Suhail Jagtai, who was a class fellow of mine from 30 years ago, called me and asked me to come and speak, I looked at the agenda and to see what I can contribute towards. He asked me to talk about depression. As we know that the World Health Organization has called depression as the #1 cause of disability around the world. And I really thought that's an important topic. I can talk about that. But the other topic, which is very close to my heart, is about self-care of providers. My esteemed colleagues, we have talked about, and that's in our training also happens, that we talk about caring for the patients. Yes, that's why we are in the profession. But we don't hear anywhere people saying how to take care of yourself. In order to take care of somebody else, you have to be able to take care of yourself. And we don't teach our residents, we don't teach our students, we don't teach our colleagues, and we don't do that for ourselves. How many doctors you see who have, if you tell me when was the last time you got a physical? People think that we are doctors, so you know how to take care of yourself. No, we are also patients. So in the 10 minutes that I've been allotted, all of 10 minutes, a lot of time in this important topic, so I made out my presentation. People are welcome to share this. It can be made available, these slides. I had put those together. There's a lot of slides, don't get scared. I'm going to be sticking to what is the take-home messages, but I think just going through this, I think that this topic is really important for us as we go forward, just to take care of ourselves and our colleagues. Don't ever forget that. And also, if you notice, I do have a portable mic because there are a few times I presented and people gave a feedback they couldn't see me. So if you can't see me, really, I'm not much of help in teaching. All right, so am I just going to figure it out? All right, so basically, this is a worldwide phenomena, burnout, and then self-care is really important for the topic that we are all here for, patient quality and safety. If a provider or a patient is sick, either physically, mentally, emotionally, their ability to take care of their patient is going to be affected, whether we like it or not. I mean, they're going to show up for work. How many times have you seen that you're sick, you go to work because you don't want to let your patients down? But are you performing at your best? Is your thinking really clear? Are you making the right decisions? So that becomes really important. And what we will explore is to recognize what are the symptoms of burnout, how do we manage it, and how do we prevent it. So bear with me. If I go too fast, just raise your hand and I will slow down. I do want to get to the end part where we'll do a few minutes of a guided meditation so you can actually experience the relaxation that you can do in your daily work.
I will give you maybe 5 minutes extra.
Okay, thank you. Oh, you're so generous. Okay, so I was looking at, so we all need to be on the same page, have the same language. So what do we mean by burnout? So I looked at the American Academy of Family Physicians, which I believe is the highest, they have the highest rate of physician burnout. They're in the front lines. So this is what they describe, a syndrome that's characterized by a loss of enthusiasm for work, which is defined as emotional exhaustion. You're just so tired emotionally, and so-called compassion fatigue. In other words, feeling of cynicism. You're doing the work, but you're not really invested in your patients. You're listening to them. You're probably distracted, thinking of other things, and there's a low sense of personal accomplishment. This has been discussed as one of the things that really drag down physicians, because the reason we are in the profession is because we want to make a difference. Because of the people we are, we put our needs last. Everybody else comes first. So I think that when they start to happen is when they start to question their whole existence. And another definition I found was, and you can see all my references are in the slides, so I've referenced them. So it's an emotional condition marked by tiredness, loss of interest, or frustration that interferes with job performance. And burnout is usually regarded as a result of prolonged stress. So the word stress is going to keep coming up, okay? And so I started looking at, okay, what are we looking at? I was just blown away by the amount of statistics that people have. 1 in 3 physicians in training is in burnout. And this quote at the end, healthcare professional burnout represents real suffering among people dedicated to preventing and relieving the suffering of others. Okay, so how counterintuitive is that? The people who are in charge, we're taking care, which we are doing all over the world, but there's no attention being paid to us. And this conference is another example. I got 5 more minutes, but 10 minutes for the topic. I think maybe next time it should be given more attention. So why is it important to us? It's the real suffering, like I said, you know, this is a repeat from that quote. I mean, this is just so important. So more than half of US physicians are experiencing symptoms of burnout. I was just blown away by these. And the frontline physicians are experiencing it most. Dr. Bilal had talked about the circumstances. You're expected to see. Yeah? Can everybody hear me? Okay. I do have a loud voice, so I'm trying to tone it down a little bit. So, let's see. Yeah, so what Dr. Bilal was talking about, so there's more and more pressure by insurance companies, by clinics to see more patients in an hour. It's all about productivity. It's all about the bottom line, the money. Nobody's paying attention to the quality of care. You know, in psychiatry, I don't work in an outpatient practice anymore, and I did want to make a disclaimer. So I'm talking as a private citizen and not representing the official place where I work. I work in a federal all-male prison in corrections. That's a whole different story in its own. So the front line, so there's a demand to see more and more patients, make more money, but how is it affecting the patients? And especially with younger junior doctors who've just out of training, and in the US, they come out from medical school having medical school loans of more than $500,000, and you don't start getting paid when you do residency. So there's a financial burden, and the same thing happens in Pakistan. You put in so much effort, so much time, so much energy in becoming a doctor, and wow, you're a doctor now, but you have empty pockets. It's really disheartening at some points. Okay, this slide absolutely blew my mind away. So there's 400 US physicians are committing suicide every single year. And just in July, the National Association of Medicine had a meeting, and they are saying we have 2 epidemics in the US. One is opiate crisis, and the other is physician suicide. The physicians, these are completed suicides. There are attempted suicides, and there are burnout. This is the complication of a burnout. Like we talk about, say, complication of diabetes, high blood pressure is, you know, if somebody's going to get stroke or an MI. Burnout, the complication is suicide. So this was the US statistics, and I looked at what's happening. I spoke to Dr. Stephen Edelman, who's the director of US PHS, and he's saying now, for the first time in 2017, they're saying, before they were calling them impaired physicians who had trouble with alcohol, drugs, behavior issues, boundary violations, complaints from the patients, and making mistakes. They're now going further back and looking at what's contributing to this, and they're looking at stress. So, you know, these were just some more statistics that we have the trainees who are in depression. I'm going to skip through the slides. Then I looked at what's happening in the UK. There's a NHS practitioner health program, which is a free confidential service for doctors and dentists who have mental health and addiction concerns. One of the things that really struck out for me was that this is the patients who are these are the physicians who are presenting as patients. 86% present with mental health issues, and only 7% for drug addictions. So then I said, okay, let's see what's happening in Pakistan. I found a very nice study which was done which talked about how many with the medical students and that in the past 1 year, 4.8% have attempted suicide, and 35% of medical students in Pakistan have considered suicide. This is really, really sad. So what I'm going to do is, just so that, again, we are on the same page with the same language. So in the US, we use DSM-5, which is the Diagnostic and Statistical Manual for Mental Disorders. So these are the, basically, I'll just go through, this is exactly from the DSM-5. So one has to have 5 or more symptoms for a 2-week period consecutively. You know, every day somebody can have a bad day. That doesn't constitute a major depressive episode. It has to be a 2-week period consistently of having 5 or more of these symptoms. So depressed mood most of the day, every day. Loss of interest in the pleasurable activities. There's change in the sleep patterns, either too much sleep or too little sleep. There's a change in appetite, too much, eating too much, and then there'll be a corresponding weight increase. There'll be having no appetite, so there'll be a corresponding decrease in the weight. There's a psychomotor agitation or retardation that basically means somebody's changed, like they just don't want to deal with the world. They are psychomotor retardation. Or agitation is like they're so irritable and snappy. If you see some colleagues who are just out to sort of snap, you say the wrong word, and you're walking on eggshells with them. That would be just their irritable change from their normal behavior. And there's a decreased ability to concentrate, think, and make decisions almost every day for a period of 2 weeks. This is a time when people are going to start thinking, oh, I can't think. They're not able to, say, complete their notes. Residents in training or students, they can't finish up, so they put in more hours. They're putting in more hours, but they're not being productive. They're trying hard, but they're not. And that's because they weren't able to think right and make decisions. This is also when bad decisions can happen and mistakes can happen. And we know that that's a very sad reality and outcome that we do have. And then there are thoughts of worthlessness or excessive guilt that starts to come in. And then there are recurrent thoughts of death or suicidal ideations. So these are so if you're seeing patients, so what I want everybody, as you are looking at this, think about yourself as potentially having this at some period of their lives, your family members, some of your patients, even if you're a cardiologist. Look at if you're seeing a patient who's had an MI, there's 30% patients will get depression after that. So an untreated depression will lead to people not being compliant with the treatment recommendations, and so their mortality goes up.
2 minutes left.
2 minutes left, okay. I guess you guys can all take this. Okay, so we did the ICD-10, it's the same. So what is stress? Essentially, stress was described 100 years ago by Dr. Walter B. Cannon at Harvard Medical School. He was a physiologist. He's the one who coined the phrase fight and flight response. Has anybody heard about that? Most people know that. It's basically that any man or animal, when they perceive a threat from the outside environment, the body goes into automatic reactions in order to to manage that. So it's a survival mechanism. We need stress to either be able to, say, fight a bigger foe or actually run away from them. If you see that purple spot, that's called the amygdala in the brain, and that is the fear response center. So when the rest of the slides, when you look through, this is where the whole cascade of events translates out. So when the brain is triggered by a threat, it could be a perceived threat, it could be a real, or it could be something that they feel that, okay, I'm in danger. So what the body, the amygdala sends a message through so there's the two processes that go on. One is an unconscious and one is a conscious. So the unconscious is the involuntary method. The amygdala senses a threat, sends a message through the sympathetic nervous system to the adrenal glands. They pump in the epinephrine, heart rate goes up, muscle tension goes up, your respiration goes up, and you're able to fight or fly, run away from a position. And then the second process is that the cortex gets involved, and the cortex will decide, oh, is it a real threat? Okay, it is, keep going. If it's not, then they say, okay, back up, it's not really a threat. So that's how, and when we have chronic stress from work, from life that happens, then the secondary messengers, cortisol gets kicked in through the pituitary gland. Okay, and so when that happens, okay, I just made some schematic drawings to make it really simple and easy for people to recognize. You can go through that. This is what I was talking about, the neurobiology. And I want to say what effects happen Okay, so here's what's the effects are happening. Your sleeping problems, your muscle tension, you get chest pains, you get GI problems, you have increased heart rate, increased blood pressure, reduced sex drive, lack of focus. Somebody who's having these symptoms and they have a medical condition, you can see that their quality of life is really down. And you can treat the best hypertension, best diabetes, but you haven't treated the depression, you're not going to have a good quality of life or the good outcomes for the patients. I was going to do a case presentation, which is the best way to learn. And I'm going to.
We probably won't have time for that.
I will just, I won't do that, and I'll just say what to do. Okay, basically, we need to keep a balance between the professional and personal life. And to remember, we are not immune. We can get strokes, we can get cancers, we can get high blood pressure, we can get depression. So we are not immune. We should understand our own ways, whatever has helped. You know, faith is a really good resource that people can turn to faith. And adopting really healthy habits. Practice what we preach. We tell our patients, eat healthy, don't smoke, have a good night's sleep, eat healthy, get regular checks. Do we do it for ourselves? Probably not. So this is the WHO recommendations. You must exercise every single day, I mean, at least this much time. Communicate with the family members. Do some relaxation techniques. And this was a nice handout that Dr. Henry Nasrallah talked about. The neuroinflammation is being talked about as a root cause for cardiac disease, like some of our colleagues mentioned, and also for a lot of mental health disorders, depression, and schizophrenia. So take-home points. I'm going to just finish up. Let's practice what we preach. Let's take care of ourselves, our colleagues, our patients, and think of us as patients as well when we are taking care of our patients. And our devotion to that and high standards of work can lead to stress, burnout, and emotional difficulties. So it doesn't make us weak in any ways. And seek professional help when needed. And there's all my references. And thank you very much. Because we rushed.
Thank you very much. We will not have time for questions, but Dr. Batool will be present in the coffee break, so if obviously people have questions, you can ask.
I have some handouts that I had made so people can take this. It's just our schematic drawings that you can take. It sort of synthesizes what I talked about. So I'm going to leave them here that you can take. Thank you.